Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Vance Lassie of Holton about bronchitis. Thanks for being here today.
Thanks for having me back.
And let's just start with, what exactly is bronchitis?
Bronchitis is an infection of the airway. So the tubes that connect your mouth and nose to your lungs are called the bronchial tubes. When they get infected, it'll get really inflamed, sometimes make a lot of mucus, and you'll get a nasty cough. So the main symptom is cough.
And how do you get it?
It's caused by a virus, almost always. And so you get it the same way you would pick up the common cold, just by being exposed to it, basically, being around someone who's sick. You avoid it by washing your hands and so forth.
How do you treat it?
The treatment for it is usually symptomatic. We don't have any good medication for cough. The best medicine for cough is probably honey. A couple teaspoons of honey and a cup of hot tea or something like that. It's about as good as anything that you could buy over the counter or prescription. However, it's frequently treated with antibiotics, and it shouldn't be. Almost always it's caused by a virus. Viruses are not susceptible to antibiotics, so antibiotics don't work. And patients often, they want something to help them. They'll sort of beg their doctors to give them an antibiotic, but then, 5 days later they're still coughing and they don't know why. They're really more likely to have bad things happen to them because they took the antibiotics than they ever would have had if they took them to begin with. So the best thing to take is time. Just take some time off work, rest, it will go away.
Is there ever a time that they should call their doctor?
Yeah, sometimes if you get a fever, you start really getting sick and the fever comes up, there are times whenever the symptoms of bronchitis were actually pneumonia or become pneumonia. And when that happens, you need to talk to your doctor. A doctor needs to examine you, maybe get a chest x-ray to make the determination on, is this bronchitis or something more severe? So there's definitely a role for physicians, but if it ends up just being bronchitis, best thing you can do is wait.
Okay, good information. Thank you for being here today.
Thank you.
Please join us next week for a new health topic discussion on House Calls.